Oh, hello there. Please take a seat. My name's Dr. Sarah. What's your name? Okay. I'm pleased to meet you. And what seems to be the trouble today? Oh, okay, a problem with your ears. All right. So how are they bothering you? Okay, there's some discomfort. Okay, they feel kind of blocked. Okay. All right. Have you had a cold or anything recently? No? Nothing you can think of. Okay. Allergies? All right. Okay. Are you getting any pain in your face or around the ear? Just some discomfort. Okay, not so much pain. Okay. And how long have you been feeling like this? Okay. You had problems with your ears before? Any dizziness, sore throat? Okay. All right. Have you been swimming or anything like that? Okay. Just need to check because sometimes water in the ears from swimming can cause a problem called otitis externa, swimmer's ear, which can be very uncomfortable. Also, your problem could be caused by earwax build-up. Okay, so I'll check that out for you. Right, okay, I'll just pop some gloves on, my lovely, and then we can have a little look and see what might be going on there. It's very, very uncomfortable, isn't it, to have problems with your ears? Yeah. Okay. Let me just take your temperature, alright? I'm just going to pop this inside your ear. Okay. Just a couple of beeps. Alright, that's perfect. Normal temperature. Okay, that's a good start. Okay, let me just have a little feel around your neck on the lymph nodes there. Tell me if anything's uncomfortable at all. Alright, okay, good. Just behind the back of the head. Okay. Just going to have a little press around your ears. Tell me if it feels sore. Okay. Okay. Press, press, press. Press around. Anything feels sore there? Okay. Just pressing from the top down to the lobe. Alright. Okay. I'll just have a look at your right ear. Just press. Press, 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 press. Anything uncomfortable there? Okay. Alright. I'm just going to insert this otoscope into your ear. Okay. It might feel a little bit uncomfortable if your ears are inflamed, so just tell me. I'll be as gentle as I possibly can. Alright, so I'll just need to pull up and back on your ear very gently as I insert it, and the little light there will let me have a look down your ear canal. Okay, keep nice and still for me. Thank you. Okay, so just going to pull up and back on the ear and insert the otoscope. There we go, well done. Okay, have a little look around. Okay, I can see a little bit of inflammation, but mainly a lot of wax, so I think that's going to be your problem. Okay, Lots of impacted earwax in there, I can see. Can't see much beyond that, so it's hard for me to ascertain what's going on behind that wax build-up. Normally we'd be able to see your eardrum, but I can't see it too well. Just going to reposition a little bit. Is that sore? A little bit uncomfortable, okay. Alright then, I'll just withdraw the otoscope now. There we go. And I'll take a look at this here. Up and back, there we go, gently pulling on the ear. Sorry if that's uncomfortable, my lovely. And I'm just going to insert that now. There we go. Okay, same on this side. There's a lot of wax build up there. Irritated canal. Okay. Definitely a lot of wax. Okay. I'll just withdraw that now. Alright. Don't want to spend too much time in there when it's uncomfortable, of course. Okay. So what I'm seeing from the little check that I've just performed is a lot of earwax in there. What happens, it builds up and it can get impacted, okay? And once it's impacted, it does need a certain level of removal. Sometimes the preparations that you can buy aren't quite strong enough, okay? Yeah, but the ear canal does look a little bit irritated, which I would expect to find, okay? But I've got a wonderful team of specialists here at the clinic, and I'd like them to take a look at you just to make sure, if that's okay. Perfect. They'll all take amazing care of you. All right, and I'd just like to get their opinion, okay, before I go removing any wax or anything like that. Okay, I always like to get their specialist opinion. Okay, so let's just see. Right, the first specialist I'm going to send you on to is Dr. C. Dr. C is absolutely amazing. He's very skilled and he'll take great care of you. And he'll have a really good look around, I'm sure. Yeah, he's wonderful. Right, let me just write that down. And we'll get you seen by Dr. C, and then he'll refer you on to somebody else for them to have a look at. Okay? There's several of us in the team, but I'd like them all to take a good look at you. Oh, you like having your ears examined? Oh, well, you're going to enjoy seeing all the specialists then. Okay? All right, well, let's get you on your way to see Dr. C. Okay, and let's see what he has to say. Okay, but I'll see you again when everyone's taken a look at you. All right then? Okay, take care. Bye-bye.
Hi, I'm Dr. C. I see we have you in as a referral patient from Dr. Sarah. By my notes here, you're experiencing some ear soreness. Okay, well, we'll take a look at you. I'm sure it's nothing serious, and, if we need another opinion, I'll send you on your way. I'm just going to glove up real quick, and we'll get started. So when did this begin? Dr. Sarah's notes indicate that you have some wax buildup. You don't clean your ears regularly. You should. I'm sure we can teach you. I think we have some pamphlets in the front of the office on proper ear care. But we'll take a look. Ear soreness can be caused by quite a few things, but I'm sure it's nothing serious. And as I said, if we need another opinion, we'll get you on your way. And we'll get you over to someone else. There's quite a few ear specialists in this clinic. So whatever it is, we'll get to the bottom of it. So, I'm all gloved up. I'm just going to take a look at your ears here. I'm going to touch them. And you let me know if you have any pain whatsoever. Any pain, any soreness, any spikes, or intense pain, let me know. Okay. Not seeing anything on the outside. No pain. Nothing when I rub ears like that. Or like that. Okay. Get my otoscope here. Turn this on. I'm going to take a look inside, okay? So here we go. I'm going to gently insert my otoscope into your ear canal. Ever so gently, taking a look inside. And yes, there's definitely some excessive wax buildup in there. Dr. Sarah's notes were completely correct. I see some inflammation. That can be the cause of soreness. But there could be many others as well. But I'm definitely seeing some impaction. That definitely could be a cause. But wait, keep looking. Take a look at the other ear here. And again, gently inserting my otoscope. And taking a look inside. Lots of wax in here too. So, I do believe we're going to need another opinion. It's quite a bit of earwax you have in there. How's your hearing? Can you hear okay? We're going to do a quick test. Close your eyes for me. I'm going to whisper a word in your ear, and I'd like you to repeat it back to me. Okay? Okay. Close those eyes. Coconut. Good. Pineapple. Good. Guava. Good. Honeydew. Good. I'm taking another look at this ear over here. It does have quite a bit of wax. You sure none of this hurts when I palpate, palpate, palpate around your ear here? And over here. I do have some additional concerns. I am going to send you to another specialist, actually, for another opinion. I believe they will be able to also confirm Dr. Sarah's notes. So, yeah, let me take another look inside. Just my otoscope here again. Just hold still for me. It's gonna be alright. I haven't seen any signs of anything super serious. So, don't be alarmed. You're gonna be A-okay. Yeah, I definitely need a little more light. So we're going to use this one too. So just hold still. Yeah, definitely going to send you off for another opinion. Take another look in this ear over here too. Need a little more light today. Just want to really make sure that I'm not missing anything here. Alright, well, as as I said, it looks like it's just a lot of earwax buildup, just like Dr. Sarah said. But another opinion would not hurt. So I'm going to send you over to my dear colleague, Dr. Yvette. She's an absolutely fantastic doctor. She'll take a look at your ears, and I'm sure she'll be able to diagnose you. If not, she'll probably pass you on to another one of her ear specialists here at the clinic. Alright? So, I'm going to write up that recommendation for you to go see Dr. Yvette, and she'll see you shortly. Have a great rest of your day. Bye-bye.
Good afternoon. Thank you for coming in. I was just catching up on some notes here. You're my next patient. Okay. My name's Yvette. It's nice to meet you. I'm just checking on some of the notes here. It looks like you were referred to us from Dr. C after examining your ears for some soreness under the assumption that it's due to earwax buildup. Okay. And do you normally experience excessive earwax, anything like that? Okay. It's always good to have multiple opinions. Well, my exam is going to be fairly routine. Should not be unpleasant by any measure. If it's okay with you, I'm going to get just a little bit close and visually inspect what your ears look like in their current state. And then with two different tools, maybe get a little bit closer with illuminated lighting. That can help us to see a little bit more into the ear. Okay, thank you. Is it okay for me to get a little close? All right, thank you. Just going to sanitize my hands here real quick. Okay. And I'm just going to get a little bit close here on your left side. Gently maneuver the outside of the ear just to see kind of how the membrane and everything moves. Does any of this feel uncomfortable or painful even? Okay. What about in this area here? Around the back of your ear? Okay. You do feel like there's pressure? Okay. I'm going to do the same on the other side. And pushing right here, does this cause any discomfort? It does, okay. I have two tools that I'm going to use. The first one is going to be external. It's just a magnified illuminated light. And so this will allow me to get a very close look at the skin surrounding the area. Is that okay? Thank you. This really can help me to see a little bit more closely at the surrounding areas. And I'm kind of about your hair follicles as well. I'm just going to pull your ear back and look into it a little bit closer. Okay. And your other side. Just kind of manipulate the ear a little bit here. A lot of the times when someone has an infection or buildup and that irritation causes the skin to get very tight. So that's what I'm looking for. I'm going to grab my otoscope here real quick. And this might be a little bit cold going into your ear canal. But let me know if it's unpleasant. It's not going to go very deep into the ear canal. But if you have a lot of swelling going on, it still can. It still can sometimes cause uncomfortable pressure. So, just checking with my light. You definitely have an obstruction. And again. Okay. Yeah. You definitely have an obstruction, so I'm going to refer you to Dr. Tinglestorm, and she should be able to do another thorough exam to confirm that diagnosis, hopefully, and then refer you to the correct outlet to get it taken care of. Well, it was a pleasure meeting you, and I hope the next time we see each other is maybe under more comfortable circumstances, all right? Okay. Thank you for coming in, and I look forward to seeing you.
How are you doing? I'm Dr. Tinglestorm, but you can call me Stormy. Very nice to meet you. Do you have a preferred name or pronoun that you want me to use when I address you? Okay, fantastic. So you have been sent here by Dr. Yvette. Yes, you have some ear problems. Okay, I'm sure Dr. Yvette left a couple notes for me. Let me just check them out, okay? Thank you. Okay, so what do we have here? Okay, ear examination to check if your ear soreness is caused by wax buildup. Okay, did your symptoms change in the meantime, or do you have anything in particular to point out before I go ahead with the examination? Good. In this case, I'm just taking my otoscope to have an initial look inside of your ears, okay, and see if there is any abnormality in the ear canal or inflammation. Okay, thank you. Not that I don't trust Dr. Yvette. Of course, I have full respect and esteem of her and the entire team of doctors that cooperate. But it's always better to do a nice thorough inspection. Yes. Let me just move on to the other ear. Double check the other doctor hasn't noticed, or vice versa. So what's left to go I am coming back to your other ear. Okay, I need you to do what I say. Very simple instruction. So, can you open up your mouth real wide, like if you were yawning? Good. Now I need to clench your teeth real tight. Clench, 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 clench. Okay, good. And open. And clench. Good. Coming back to the other here, asking you to follow my instruction again. Okay, so open up your mouth real wide as you can. Good. And now clench your teeth real tight as tight as you can. Do you feel any pain or discomfort when you do so? Okay, so please open up again. And now clench again. Alright, interesting. I'm just grabbing this instrument right here to have a deeper look just inside of your ear canal, but you're not gonna feel it, okay? Okay, so just have a look, just so stay as relaxed as you possibly can. Relax, and relax. Good, you're doing an awesome job. And now this here as well. Relax. And relax. And relax. And relax. Relax. And relax. Good. Okay. Alright. Okay. I don't see any abnormality in the ear canal or any specific kind of irritation that is going to need to be pointed out today. I just want to make a couple hearing tests to really make sure that your hearing is not too affected. So first I'm going to start with this brush. Okay, I'm just going to very gently brush the surface of your ear. Can you perceive that? Okay, can you both hear and feel? And is the sensation the physical sensation neat, or is it feeling a little bit numb maybe? Okay. Can you perceive a difference if I do this and this? Good. How about here? This. Okay. Good. Now instead, I'm going to wiggle my fingers like that. I need you to tell me when you stop hearing them, okay? Or if they are close or far away, okay? Good. Okay. What if you cannot see them? Can you still? Okay. Okay. And now you tell me left. Alright, okay. What if you cannot see? Can you still understand whether it's left or right? Good. I'm just going to whisper some words and numbers into your ears, and I need you to repeat them for me, okay? Cardboard, doll, hair, paper, snatch, drawer, vacuum, honestly, I don't think you are experiencing any ear loss or any abnormality in your ear canal. I agree with Dr. Yvette's opinion that your discomfort and ear soreness can just be caused by a wax buildup. But as I mentioned before, double checking is always better. So I would want to address you to a great expert that I really admire a lot and that can confirm our opinion or maybe find other issues so that we will know how to treat you further on. Whatever that can be the final result, you'll be in great hands. And that's Dr. Muzz. He is an amazing professional. So I'm gonna write down a couple notes for him, just real quick, but I'm sure he will already know what to do to better treat you. Okay. Thank you for visiting me. I hope that we will soon find what is giving you that discomfort in your ears. In the meantime, please take great care of yourself. Bye.
Hey, how's it going? Good, yeah, come on in. Yeah, I'll be with you in just a wee second. I'm just looking at your paperwork here, okay? I'm Dr. Moss, by the way. Yeah, good to meet you. So, it says here you've been referred to me from Dr. Tinglestorm. Is that right? Well, not quite sure what else I could do for you that Dr. Tinglestorm hasn't already done, because she is absolutely one of the best ear doctors out there. But she referred you on to me, so I'll have a wee look and see if we can I can come up with anything that maybe she missed. Alright, okay. So, just gonna have a wee look inside your ear there. See if there's anything that looks untoward. That's the usual, isn't it? Bit of a build up. You can hear me okay though, right? You can hear me, yeah. Well, it's obviously not that blocked then, otherwise you wouldn't have a clue what I was saying. So, I think so far so good. Have you had any, like you've been swimming lately? Right, okay. And would you say it was both of them or just this one? Right, well, I'll have a wee look at the other one as well. See if, oh yeah. It does look a wee bit like there is some inflammation going on there. Just not ideal at all. Yeah. But I've seen worse. I've definitely seen worse. So let's just have a wee, sorry if that's uncomfortable. Let's have a wee look deep inside there. Okay, see. Yeah. Seen worse. Seen worse. Now, if you've been sticking, you always get asked this question. I'm sorry if any of the other doctors you've seen about this particular problem have asked you this question. I guarantee at least one of them has. Have you been sticking Q-tips in your ears? Remember, you're not supposed to stick anything in your ears that's sharper than your elbow. Just remember that. If it's sharper than your elbow, don't stick it in your ears. Right. I'm going to have one last wee look here, because it looks like you're getting the full treatment. Second opinions, third opinions, fourth opinions now. If a second opinion is good, then, I don't know, let's have six. I mean, six opinions are even better, right? So, yeah. So it looks to me as though Dr. Tinglestorm, that perfect workup, everything that she wrote down, I'm seeing too. So I don't know how much I've added to it, but I am going to pass you on, okay? I'm going to pass you on to Dr. Quaint. Alright, she's a wee bit younger, and sometimes you need a wee bit of younger blood to spot things that the old people miss. Yeah. So Dr. Quaint, she'll sort you out. Alright, yeah. Okay, but the thing is, I'm talking pretty quietly, and you can hear me, you can understand, or your lip, okay, your lip reading, right? So you can understand me, okay? Yeah. So it's bad, but it's not that bad. Okay. So we'll get you fixed up. Anyway, I'm going to pass you off to Dr. Quaint now. Okay. Yeah. And she'll sort you out. Alright. No problem. You take care.
Hi there. How can I help you today? Oh, okay. You've been referred by Dr. Moss. Let me put up your file. Okay. Can you help me with your name, please? Great. Thank you. Alright, so patient number. Okay, so fair enough. We are dealing here with a case of ear pain. Is it both ears? Just one? Okay, and do you have any other symptoms? Like, do you have a headache or loss of hearing? Or maybe you have any pressure in your ear canals? Alright. Okay. Well, in this case, let's just get to it, and I'll have a quick look, if that's alright. Yeah? Alright. Let's put my gloves on. So I'm going to just start with touching your ears. Please let me know if you have any pain or any other unpleasant sensations. Okay, just gently pulling. Does it hurt? Okay. Any discomfort? How about when I press here? Okay. Slightly pull your ears. Anything? Right. Okay, good. Let's check your lymph nodes then. Anything here? Nothing really. Okay. Did you have any cold recently? Checking your fever. .2, brilliant. Alright, let's just have a quick look inside your ear. I'm gonna use the otoscope. Probably already know how it works. Okay, let's just have a look. I think it just sit still for me. Alright, and the other one. Right. Okay, so the thing is that I can't see much because there's quite a huge buildup of wax in your ear. Did you try to clean it off with an earbud? Okay. Well, if it's possible, please avoid doing that in the future, because basically it pushes the earwax further into the ear canal, and then it results in what you're experiencing right now. I think I would like Dr. Nicola to have a look at this. She's obviously a great specialist. She will definitely know how to take it forward. Yeah? Okay. So what I'm gonna do, I'm just gonna write a quick note on your file so you don't have to carry any referral with you. Is that alright? Great. Just a second. Okay, so that's us. I hope that you will get your ears fixed very soon. Yeah, okay. Bye.
Hello, lovely. How are you? Good. I'm Dr. Nicola, and I'm just going to carry out an ear examination. I believe that you've just seen Dr. Quaint, and you've just come to me for a double check. Is that right? Okay. So, I believe you've been experiencing some problems with your ears. Yeah? Okay. Right, that makes sense. Okay. Well, what I will do, I will have a good look around your ears and in your ears, okay? And I'll just see what's going on, and then I can recommend some kind of treatment if it's necessary. Alright, good. So, I'm just going to start by feeling around your ears, okay? Any pain when I squeeze? And what about when I stretch? How was that? I'm just going to go on to the other side. Any pain with any of that? going to get my otoscope and I'm going to have a look in your ears, okay? And in we go. I'm just having a look around the edge at the moment. I'm just going to go a little bit deeper. Any pain? Okay. Does that hurt there? Okay. Okay. Same again the other side. Okay. And in we go. Again, I'm just having a look on the edge. I'm going to go deeper now. Does that hurt? Okay. Okay. Feeling alright? Okay. you've definitely got a blockage going on. A lot of build-up of wax. I think it's best that you go back to Dr. Sarah so she can carry out a full ear cleaning on you, alright? And just remove all that wax. Okay. Well, you're very welcome. Okay, my love. So please head on through to Dr. Sarah. You take care now. Bye-bye.
Oh, hello again. How did you get on? You okay? All right. Okay. So, oh, you've seen Dr. Nicola, yes, and she sent you back to me. Okay. She's wonderful, isn't she? Yes. Okay. So, got all your notes here from all the specialists that have seen you. Okay. So, you've seen Dr. C. Alright, okay. You've seen Dr. Yvette, Dr. Tinglestorm, and you've seen Dr. Quaint, Dr. Muzz, Dr. Nicola. All the best people. That's wonderful. So let me just see. It looks like everybody has come to the same conclusion that your problem is purely impacted earwax. Okay, which confirms what I thought in the first place. Okay, let's just look there. Okay. That's perfect. So yeah, they've all said your ears are impacted, so therefore they need a good clean. Alright? Are you happy with that? Good. Okay. Right then. Let's get ready. I think what I'm going to do is give your ears a nice clean round. Okay? And that will be very refreshing for you. Before I start, we'll clean on the outside of your ears. Alright. Got some nice cooling spray here. Alright. Okay. Gentle wipe round there. There we go. Let's have a look at this right here. Nice soft gauze. Okay, just have a wipe around there. Nice wipe around there. Okay. Perfect. That nice and cooling. Alright. Okay. I'll take a quick look with the otoscope, and then I'm going to put some nice drops down your ears. Alright. Let me just pull up and back and insert that. There we go. I know you've had a lot of this, so I'm not going to do too much. I just want to double check there. Okay, so just checking which drops I need to use, but yeah, I know what I'm going to use there. Okay, right, let's just withdraw that. Okay, I'll just double check this side. Okay, up and back there. Well done, just insert that gently. Okay, there we go. Yeah. Right, I know what I'm going to do. I'm going to put some drops in your ears which will fizz a little bit, okay? And that will work its way through that impacted wax, and then I'll be able to remove it. Sometimes I'll need to go in a couple of times, maybe with some different tools. Alright. Okay. It might feel a little bit uncomfortable just because they're so impacted, but there shouldn't be real pain. Are you okay with that? Alright, okay. So, got my special mix of drops here. These are stronger than what you can buy from your pharmacy. You can get some drops that do a bit of fizzing, but these are specially prepared by us. Alright. Okay. They tickle a bit when they go in, alright, but they won't sting or burn. Okay. So, just get some gauze there. Let me just pop some into your left ear. Okay, nice and still for me. Thank you. There. It should start to fizz. Yeah. Okay. Oh, you like that? Good. It's rather pleasant, isn't it? Okay. Just pop some into your right ear. Here we go. Nice and still for me. Thank you. All right. Well done. So, I'm going to give those just a little massage. Alright? Just a little massage. Lovely. Is that nice? Good. Little massage on your ear. Gentle massage just to work those drops in. Okay. And on this side. Gentle massage just to work those drops in. There. Perfect. Oh, it's making you feel sleepy. That's good. Okay. So, first thing I'm going to do is just use a tool. Okay. Don't be frightened by this. It won't hurt you, it just helps to loosen the wax. I just pop it into the ear and just rotate. Okay, just rotate. Okay. Alright. So let's start with this side. Alright. Are you comfortable there? Sure? Okay, right, let's just pop that in and just rotate that round. Rotate. Does that feel okay for you, my lovely? Good. Just turn that round and round. Okay, good. Don't need to do too much with that. I'll just do the same in your right. Okay, let's take a look in here and pop it in. There we go, and just gently rotate, there, round and round, rotate. Start to break that wax up. That's perfect. Absolutely perfect. There we go, well done. just going to give a little brush on the outside. Okay, just for some little pieces that will just come off. Okay. Before I go any further inside, that'll tickle, I'm sure. It's lovely, isn't it? Just a gentle little brush off there. Okay. And on this side, gentle little brush off there. Alrighty, that's good, okay, perfect. So, now I'm just going to use this tool and have a little pick. Alright, so you'll hear little picking sounds, but it shouldn't be uncomfortable because the wax has already started to come away. Okay, alright. So, keep very, very still for me and you'll just hear some little picking sounds. Just inserting that now. Pick, pick, pick. Okay, just picking away there. Okay. How was that? Good, good. Okay, and on this side, just inserting it now. Just a little bit of picking. Pick, pick, pick. Little picks. It's making you giggle. Making me giggle. Just picking. Alright. Wonderful. Okay. I'm just going to give them another little massage. There we go. Is that comfortable for you? Perfect. There. There we go. How does that feel? Good. Have a little look, okay? Just up and back in there, okay. Pop that in. Oh, there you go, I can see your eardrum now, your tympanic membrane, and that's really healthy, so that's good. Those drops work very well, and there were some large pieces of wax that came out, so that was the impacted wax coming away. So there's no damage to the eardrum there, which is wonderful. I can see the structures, light reflex is normal, so that's perfect. Okay, that's looking so much better. Right, let me just withdraw that. Okay. We're looking good. We're looking good. Okay, just pull up and back and insert that. There we go. Well done. Oh, that's looking wonderful too. Clear, healthy eardrum there. And that wax has come away in nice, easy, sizable chunks, so that's good. That's good. Okay. Just remember never to push Q-tips down your ears, if that's what you do. Let me just remove that. Okay. These Q-tips should never go right down your ear. It's okay just to clean around the outside, which is what I'm going to do now, out just very quickly. Okay, so just a little wipe around the outside. There we go. Perfect. Wonderful. Okay, so I'm just going to get another spray and give them a final wipe round. Alright, just bear with me a second. Okay. Let's get these nice spray before I let you leave. Okay. The lovely big cooling wipe. This is more just to cleanse but to cool off and make them feel all refreshed afterwards. This smells lovely, this spray, doesn't it? Yeah, so good. Okay, so you're feeling all right there? Not dizzy or anything like that? That's perfect. Okay, wonderful. So I'll report back to the other doctors just to say they've had that cleaning. Okay, any further problems or you feel the wax is coming back, do let us know. Okay, some people naturally have a lot of problems with earwax. Okay, some people don't get so much, but some can have a lifelong problem with production of earwax. Yeah, do you wear earbuds at all? Headphones? Okay, because that can cause problems if you wear them a lot. Yeah. Alright, well, we're happy to have a check on you again, that's not a problem, but you should be feeling much more comfortable now. That's perfect, that's what we like to hear. Okay, well, I'm glad that between us we've been able to make you feel more comfortable. And it's quite a simple procedure, isn't it, to get those ears cleaned out? Yeah, okay. Yeah. Alright, so enjoy the rest of your day, and I'm happy we've been able to help you. Okay, take great care.